Hi guys, Dr. Pham again. Today we're going to talk about hydronephrosis, another educational series brought to you by PhamUrology.com. So before we can understand hydronephrosis, let's look at normal anatomy of the kidney. So we're going to draw out two kidneys. And this can be your right or your left depending on your perspective. Then we're going to draw the bladder. Let's make the bladder yellow. And then we'll draw the penis. We'll just make it red. And then we'll draw the spine. We'll just make the spine gray. And then we'll have two parts of the brain right here. Okay. Then, so normally the kidney filters water or blood, and then it turns all the waste of the blood into urine. And urine travels down here as urine. And as the bladder fills up, it will then send a signal to the spine, which will then send another signal back down to the bladder to tell the bladder to squeeze, and a second signal to tell the P channel to open, and the urine is supposed to go out one way. Now, once the bladder contracts, it'll close the ureter so that urine can only go up and then not go down. Okay? Now, we're going to talk about hydronephrosis, or fluid in the kidneys. Well, what causes hydronephrosis? Well, typically, urine is supposed to flow freely from the kidney into the bladder and then out. However, you can have areas of tightness that causes the urine not to drain as well, and then it causes a backup. So normally when urine is supposed to be going down this direction, instead it's getting a backup and it's getting pushed this way. And hydronephrosis is an imaging finding that we find on renal ultrasound or CT scan. And typically hydronephrosis indicates that there may be something else going on. Now, just one image alone, sometimes it's very hard to differentiate what is causing the hydronephrosis. But before we go into figuring out hydronephrosis itself, well, what's the problem with having some hydronephrosis? Well, what happened is hydronephrosis indicates fluid is built up in the kidney system, and that increases pressure on the kidney itself. Well, if that goes on for a long time, part of the kidney slowly starts to deteriorate, and that's how you lose a kidney. Now, how do we find out what is causing this? Well, one of the things we always look at is it urine that's actually going back up to the kidneys? Because that can cause a hydronephrosis type picture. And that's something what we call vesicle ureteral reflux. And how we rule that out is we place a little catheter and we put some dye in. And once the bladder fills up, we pull the catheter and then we let the child pee. And we take some images in which we can see if urine's actually coming back up to the kidneys. If it is, then that's considered vesicle ureteral reflux. The management for that becomes a little bit complicated. If your child have that, then come visit me. We can talk about what we do from there. Okay? This is just a general overview today. Second thing, could it be that where the urine's coming down from the tube that connects the kidney to the bladder, which is known as the ureter, could it be tight? Well, now it may be tight at this area, or it may be tight where the ureter meets the bladder. Well, we give it a different name. If it's tight where the kidney and the ureter meet, we tend to call it UPJ obstruction. So that means this area is tight. So when urine comes down, instead of flowing freely, some of it gets backed up, and it causes the same issue. It causes back pressure on the kidney, which will then cause the kidney to deteriorate or shrink. There's a test that we can do that can test that. It's a test that they put some dye in to the IV, and then the dye will then travel to the kidney, and then it will measure how well that kidney will drain. And it will tell you two things. It will tell you what is the function of that kidney, as well as the drainage pattern. Now, it may drain very well here, but then it may not drain very well here. And so that is something what we call ureteral vesicle obstruction. Okay? And what that means is it's tight where the ureter and the bladder meets. Typically with that, surgical intervention is warranted, just like the UPJ or the ureteral-pelvic junction obstruction. Those usually will require surgical intervention. However, some of them we can watch. And like I said, you know, depending on which therapy, this is a conversation you kind of have to have, you know, a talk with your doctor. Okay? Now, number 4. Well, what if we did the test and there was no vesical ureteral reflux, and there is no ureteral pelvic junction obstruction, and there is no ureteral vesicle junction obstruction, but it's just a dilated system? Well, this is something we call idiopathic hydronephrosis. And what this means is, well, we know something is going on. What we don't know is what's causing it. So it could be that something happened, but now that something is gone. And just like a stretched pair of pants, sometimes it takes a while for the ureter and the kidney to go back to its normal size. Now, it may never go back to its normal size, but that does not equate clinical deterioration. And those can often be watched. Okay? So this is just a brief interview of hydronephrosis and the most common etiologies that can occur with this. If you feel like your child has hydronephrosis and you would like to be seen or a second opinion, please reach out to me at phamurology.com. We'd be more than happy to talk about this and talk about possible intervention or even conservative management. All right, guys, shoot me a letter. If you guys like this, give me a thumbs up.